Asthma is a common respiratory condition that affects the airways in the lungs. These airways become inflamed and narrow, making it difficult to breathe. This condition can cause symptoms such as wheezing, shortness of breath, chest tightness, and coughing, especially at night or early in the morning. It affects millions of people worldwide, regardless of age, gender, or ethnicity. Asthma does not discriminate and can impact anyone, from young children to the elderly. This chronic disease inflames the airways in the lungs, making breathing difficult. The inflammation causes the airways to swell and produce extra mucus, which further obstructs airflow. This can lead to asthma attacks, which are sudden episodes of severe symptoms. Asthma can have a significant impact on a person's quality of life. It can limit physical activities, cause frequent hospital visits, and lead to missed school or work days. The constant management of symptoms can also be mentally and emotionally draining. It is a global health concern that requires attention and action from healthcare providers, policymakers, and communities. The prevalence of asthma varies across different regions, but it remains a significant issue worldwide. The World Health Organization estimates that 262 million people had asthma in 2019. This staggering number highlights the widespread nature of the condition and the need for effective management strategies. It sadly caused 461,000 deaths that year. These deaths are often preventable with proper treatment and management, underscoring the importance of awareness and education about asthma. This highlights the importance of understanding and managing this condition. Education about asthma triggers, proper use of medications, and regular monitoring can help individuals control their symptoms and prevent severe attacks. Asthma can affect anyone, however, it is often diagnosed in childhood. Early diagnosis and intervention are crucial in managing the condition and improving the quality of life for young patients. While there is no cure for asthma, it can be controlled with the right treatment plan. Medications such as inhalers, lifestyle changes, and avoiding triggers can help manage symptoms and reduce the frequency of attacks. With proper management, people with asthma can live full and active lives. They can participate in physical activities, enjoy social events, and lead a healthy lifestyle. Understanding asthma and adhering to a treatment plan can make a significant difference in the lives of those affected by this condition. Asthma symptoms vary from person to person. Some individuals might experience mild symptoms that are easily managed, while others might face more severe symptoms that can significantly impact their daily lives. Understanding the range of symptoms is crucial for effective management. Some people experience symptoms frequently, while others only have them during certain times. For instance, symptoms might flare up during physical activities like exercise, or in response to stress, allergens, or even changes in weather. Recognizing these patterns can help in managing asthma more effectively. Common symptoms include wheezing, coughing, and shortness of breath. Wheezing is often described as a high-pitched whistling sound that occurs when breathing, particularly during exhalation. This sound is a result of air passing through narrowed airways. Wheezing is a whistling sound when breathing. It happens when air flows through narrowed airways. This can be particularly noticeable during the night or early in the morning, and it can be triggered by various factors such as allergens, cold air, or respiratory infections. Coughing is another common symptom and may be worse at night or early in the morning. This persistent cough can be dry or produce mucus, and it often disrupts sleep, leading to fatigue and decreased quality of life. Shortness of breath can make it difficult to catch your breath. This sensation can be alarming and may lead to anxiety, which can further exacerbate the symptoms. It's important to stay calm and use prescribed medications to manage this symptom effectively. Chest tightness is another symptom. It can feel like a heavy weight on the chest. This discomfort can make it hard to take deep breaths, and can be particularly distressing during an asthma attack. Recognizing this symptom early can help in taking prompt action to relieve it. These symptoms can range from mild to severe. Mild symptoms might be infrequent and easily managed with medication, while severe symptoms can be persistent and require more intensive treatment. Understanding the severity of your symptoms is key to managing asthma effectively. It is crucial to recognize them early. Early recognition of symptoms allows for timely intervention, which can prevent the condition from worsening and reduce the risk of severe asthma attacks. Educating yourself about the symptoms and their triggers is an important step in managing asthma. Early recognition allows for prompt treatment and prevents complications. By identifying symptoms early and seeking appropriate medical advice, individuals with asthma can lead healthier, more active lives. Regular checkups and following a tailored asthma action plan can make a significant difference in managing the condition. To understand asthma, we need to understand the airways. The airways are like tubes that carry air in and out of our lungs. In asthma, these airways become inflamed and swollen. The inflammation makes the airways very sensitive, and they react strongly to certain triggers. This reaction causes the muscles around the airways to tighten, narrowing the airways even more. This narrowing makes it difficult for air to flow freely, leading to the symptoms of asthma. The inflammation also increases mucus production, which further obstructs the airways. This process makes breathing difficult and uncomfortable. Asthma triggers vary from person to person. Common triggers include allergens like pollen, dust mites, and pet dander. These allergens can cause an allergic reaction in the airways. Irritants like smoke, air pollution, and strong odors are other triggers. These irritants can directly irritate the airways. This irritation leads to inflammation and narrowing. Exercise can also be a trigger for some. This is called exercise-induced asthma. Cold air, changes in weather, and respiratory infections can also trigger asthma. Identifying and avoiding these triggers is crucial in managing asthma. Section 5. Inside an asthma attack. Asthma is a chronic condition that affects millions of people worldwide. Understanding what happens during an asthma attack can help manage and prevent these episodes. An asthma attack occurs when the airways become significantly inflamed and narrowed. This inflammation is often triggered by allergens, pollutants, or even stress. The airways, which are the tubes that carry air in and out of your lungs, become swollen and produce extra mucus. This makes breathing very difficult. The sensation can be likened to trying to breathe through a straw, making each breath feel labored and insufficient. The struggle to get enough air can be frightening and exhausting. During an attack, the muscles around the airways tighten, further narrowing them. This is known as bronchoconstriction. The tightening of these muscles is a natural response to the inflammation, but it exacerbates the problem, making it even harder to breathe. The lining of the airways also produces more mucus. This mucus is meant to trap and remove irritants, but during an asthma attack it becomes excessive. This mucus is thick and sticky. It clogs the airways, further obstructing the flow of air. The combination of inflammation, muscle tightening, and mucus production creates a perfect storm that makes breathing extremely difficult. This combination of muscle tightening and mucus production makes it hard to breathe. Inhalers and other medications can help to relax the muscles and reduce inflammation, providing relief. Symptoms of an asthma attack include severe wheezing, coughing, shortness of breath, and chest tightness. Wheezing is a high-pitched whistling sound made while breathing, and it indicates that the airways are narrowed. The person may struggle to speak in complete sentences. This is because speaking requires airflow, and during an asthma attack, the airflow is severely restricted. The effort to talk can make the breathing difficulty even worse. They may also experience anxiety and panic due to difficulty breathing. This anxiety can create a vicious cycle, as panic can lead to faster, shallower breathing, which can worsen the symptoms. Understanding these symptoms and having a plan in place can help manage asthma attacks more effectively. Section 6. Managing asthma treatments. While there is no cure for asthma, it can be effectively managed. The goal of asthma treatment is to control symptoms and prevent attacks. This allows individuals to live normal, active lives. The primary treatment for asthma is medication. Inhalers are commonly used to deliver medication directly to the lungs. There are two main types of inhalers: relievers and preventers. Reliever inhalers provide quick relief from symptoms. They relax the muscles around the airways, allowing for easier breathing. Preventer inhalers reduce inflammation in the airways. They are taken daily to prevent attacks. Section 7. Unraveling the causes. The exact causes of asthma are not fully understood. However, it is believed to be a complex interplay of genetic and environmental factors. Genetics play a role. People with a family history of asthma are more likely to develop it. Environmental factors also contribute. Exposure to certain allergens and irritants early in life may increase the risk of developing asthma. These exposures can trigger the immune system. This triggers the immune system to overreact in the airways, leading to chronic inflammation. Researchers continue to investigate the complex causes of asthma. Section 8. The poverty-asthma connection. Studies have shown a link between poverty and a higher incidence of asthma. Children living in poverty are more likely to develop asthma. This link is likely due to various factors. Poverty often means living in areas with higher levels of air pollution. It can also mean living in crowded conditions. This increases exposure to allergens and irritants. Children living in poverty may also have limited access to healthcare. This limited access can lead to delayed diagnosis and treatment. Addressing these social and environmental factors is crucial in reducing the burden of asthma in disadvantaged communities. Section 9. Conclusion: breathing easier with knowledge. Asthma is a chronic respiratory condition that affects millions worldwide. Understanding the symptoms, triggers, and treatment options is crucial for effectively managing this condition. While the exact causes of asthma remain unclear, a combination of genetic and environmental factors is thought to play a role. Addressing social and environmental factors, particularly those linked to poverty, is essential in reducing asthma's impact. By raising awareness, promoting research, and advocating for equitable access to healthcare, we can help individuals with asthma breathe easier and live healthier lives. Don't forget to subscribe for more interesting facts and updates on health and wellness.